Hi, you guys. Welcome back for our daily practice questions. It is day 199 and our Pharm series continues. But as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my MP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description and houses all the resources that I offer. Also, if you're looking to enroll in the upcoming 5-week intensive review, class runs from August the 11th through September the 12th, and there's 3 spaces available. The link to enroll is in the description of this video. All right, you guys, question number one. A 12-year-old obese male presents with a limp and a dull hip pain that radiates to the knee. On exam, there is a limited internal rotation of the hip. X-ray confirms a slip capital femoral epiphysis, so SCFE. What is the most appropriate initial MP action? Is it A, prescribe NSAIDs and initiate physical therapy? Is it B, refer urgently to ortho and place the child on non-weight bearing? Is it C, encourage weight loss and follow up in 4 weeks? Or is it D, order an MRI to rule out a vascular necrosis before treating? Take a moment and tell me what you got, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, what is the most appropriate initial MP action? Now, y'all know this is just another form of a treatment style question, so I always tell you when they're asking for a treatment, look to see if there's a diagnosis provided. And here there is SCFE, your slip capital femoral epiphysis, right? Is the diagnosis. So it's asking you what is the most appropriate initial treatment, right? So the initial action, first line therapy is what it's asking you. And B is your best answer. Remember, you want to refer them out urgently to ortho for potential surgery and make sure that they're not weight bearing because this can lead to necrosis. So it's actually classified as an emergency. So you want to refer. All right, question number 2. A 7-year-old boy presents with intermittent limp and mild hip discomfort. X-ray shows early flattening of the femoral head consistent with leg calf parathesis disease. What is the most appropriate outpatient treatment plan at this time? Is it A, refer to ortho and restrict high impact activity and monitor? Is it B, prescribe corticosteroids and allow return to sports? Is it C, recommend total hip replacement? Or is it D, start antibiotics and order blood cultures? Take a moment and tell me what you got in the comments, y'all. All right, so stem of the question states, what is the most appropriate outpatient treatment? So we're going to look and see if we have a diagnosis, and we do. We have our leg calf disease, right? And so it's asking what is the most appropriate outpatient treatment. Here, the best answer is A. We're still going to refer. These are orthopedic issues. We are going to refer. That's not our scope. We identify the problem, we can assess, diagnose, and refer out for further evaluation and treatment, right? Refer to ortho. You want to restrict that high impact activity and monitor them, but refer. Now, this is not as urgent as SCFE is. You want to monitor them and refer out, but you can do symptomatic management. Surgery is not the first line option in these mild type cases, but ortho will determine if it is severe and warrants surgery, but refer out for further evaluation. All right, and question number 3. Which clinical feature most strongly favors a diagnosis of SCFE over leg calf disease in deciding urgency of ortho referral? Is it A, onset in toddler under the age of 3? Is it B, a gradual onset of painless limp? Is it C, obese adolescent with acute pain and externally rotated leg? Or is it D, hip pain worse in the morning with systemic symptoms? Sorry. Take a moment and tell me what you got, y'all. All right. And here the question is the stem. The stem is the question, and it states which clinical feature most strongly favors a diagnosis of SCFE over leg calf disease in deciding the urgency of ortho referral. And it's C. So, an obese adolescent with acute pain and externally rotated leg, SCFE commonly is in obese preteens and teens, having that rotated leg, hip that is being with sudden discomfort, I should say, sudden pain, whereas leg calf sometimes don't have pain at all or is gradual and mild in nature. So C is your best answer for those classic determining factors, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. Everything that I offer is linked in the bio of this channel, including my website. And as I mentioned earlier in the video, my website is also linked in the description of this video, and it houses all of my resources, and it's broken down for first-time test takers as well as those who may be retesting to show you what may work better for your scenario. But all right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.